Hi, in this video, I'm going to be talking about breast cancer in young women, specific challenges and considerations that are faced by young women with breast cancer. Before I go on, don't forget to subscribe to our channel. We put new content out about 3 times a week, so it'd be great if you could click that subscribe button. So we tend to think of breast cancer as occurring in older women. And in fact, fewer than 10% or 1 in 10 people will be diagnosed with breast cancer under the age of 40. When we talk about breast cancer in young women, we're generally talking about that age group. Women 40 and under is our young breast cancer diagnosis group that we talk about. Now, you might be 70 and consider yourself young, and we do too, but this is sort of this technical definition of breast cancer in young women. So why is breast cancer in young women different? Well, we're continually reinventing ourselves throughout our lives. And up to the age of 40, we are still in school, we're still finding our partners, we're growing our family, and we're still really developing a sense of self. If you're really under 40, if you're in your 30 or your 30s or your 20s, you are still figuring out who you are. And although that process does continue no matter how old we are, there's really no point at which we can't reinvent ourselves. Society is built around that period in our life being there for us. The world is our oyster. We are discovering all the horizons out in front of us. And now comes the diagnosis of breast cancer, which is a serious illness. Even if caught early, even if it's not invasive, this is a serious interruption of your life story. You have these chapters in your life, and we have the sense that we control, or we're the author of those chapters. And when breast cancer or other serious illness interrupts our life story, it is a life interrupted. A lot of my older patients tell me, I'm in my 60s. I've had my kids, I've built my career, and yes, I still have a lot of life ahead of me, but it's not the same as if I had been younger in my 20s or 30s. So, even those of us who are older recognize that you're still in this life-building, life-defining stage of your life, and then whomp, something comes along and interrupts that. So in your career, you are still ascending the ranks. You're acquiring skills. You have your eyes set on the next step on the ladder. Again, that doesn't end when we're 50 or 60 or 70, but this is part of your development when you're less than 40, is laying out your career path. You might be switching careers and you feel you have so much ahead of you, and then you're diagnosed with breast cancer. The other major thing that happens when we're under 40 is we're building a family. You may be looking for a partner. You may be deciding to grow your family with or without a partner. You may have 1 child or 2, and you are building your family. So all of these things are part of what happens when we're growing to 40, which is not to say we don't continue to build our families after that. But in general, we consider our childbearing years to be up to 40 to our early 40s. And breast cancer interrupts that. It can put a pause on when you build or add to your family. It can change your hormones. It may put you into menopause early. And all of these things make breast cancer in people under the age of 40, breast cancer in young breast cancer patients, unique from breast cancer in the population as a whole. Now, the other problem is you are one among few. The actual percentage is that 7% of people are diagnosed below the age of 40. That means when you see marketing campaigns, when you see people in the waiting room, when you think about breast cancer, you're thinking about an older group of people. This can be very isolating, and you may feel very lonely as you sit in a room with a lot of other people who look older than you, because they are older than you. You may feel like you stand out. You may feel like you don't belong there, either because of the way people look at you or because of the messages that you get based on what a typical patient with breast cancer might look like. A lot of marketing campaigns leave out, or awareness campaigns, I should say, leave out younger people. I do, as an aside, want to tell you that the average age in advertisements for medications for breast cancer is actually somebody in their early 40s. So it's interesting that what we see on billboards when new drugs are advertised or on television, people tend to be younger than the actual age of the average person with breast cancer. But in general, what you're going to find if you're younger than 40 is that you are the youngest person in the room, in the treatment center, in the waiting room, and you will find yourself having an affinity to other people who are younger, who may actually not have much more in common with you. And that's okay, but don't feel you have to get along with everybody who's younger. You may need to find your own community. I'll get more to talking about building community in a moment. Next, I'm going to talk about the impact of different types of treatment in the treatment of breast cancer and how those affect people under 40 differently from over 40. Now, this cutoff is a little unnatural when we talk about really any of these changes, but I do want to spend the time speaking specifically to people who are under 40 and those who love them. So let's start with surgery. When you're under 40 and you undergo surgery, this can have a major change in how your body looks. And you may feel, I'm too young to lose a breast. I'm too young not to be able to wear my bathing suit, my bikini, that low-cut dress because of the surgery I've had. Now I feel self-conscious, or I feel I can't wear that dress, that outfit, that swimsuit, etc. And this may feel like something's been taken away from you because it kind of has. And this is an age at which you may still feel very sexy, very youthful. And the fact that you have to alter what you wear, or that you're tempted to alter what you wear, or that people pressure you to alter what you wear because of the surgery you've had, that can be very difficult. That can lead to grief and anger. It is a form of loss. It's important to let yourself feel all of those feelings. If you have reconstruction, you may have additional incisions that you wouldn't have if you had just breast conserving surgery, which is enough. It affects the breast and the lymph nodes. Reconstructive surgery affects the surgery in other parts of the body. Check out our video to learn about different types of reconstruction. The next type of therapy that you'll hear about a lot is chemotherapy. And chemotherapy after the age of 40 is more likely to cause either temporary or permanent menopause, loss of function of the ovaries. And this can affect a lot of things. It can affect how you feel and your ability to conceive. I'd love to refer you to our video on fertility preservation for people who are still menstruating when they're diagnosed with breast cancer, because we cover a lot of that. But even if you're done with childbearing, even if you don't want any kids or more kids, you've had enough, the fact that you are put temporarily or perhaps permanently into menopause leads to changes in your body that are unwelcome for many people. Now, for some people, they are welcome. They are so happy to have their menstrual periods go away. But for other people, the loss of their periods means the loss of their body's own levels of estrogen that we see before the ovaries stop working. And that can be really hard, not just the day-to-day side effects, but really the meaning that they are no longer having ovarian function. Again, even if they didn't want kids or they're done, there's something that sort of happens to us mentally and emotionally when we know we've gone through the menopause. So I just want to validate. It's really important to validate that, again, even if childbearing is not part of what you were planning as one of the chapters in your life story. Targeted therapy is often given along with chemotherapy or after chemotherapy, and we ask that people avoid becoming pregnant if they can become pregnant during that time, because we don't have safety data saying that targeted therapy is safe for an unborn child. And then finally, is hormonal therapy. Hormonal therapy is also not safe to be given if you're trying to conceive or if you're pregnant. So we ask that people who are able to become pregnant avoid pregnancy when they're on hormonal therapy. This can put an interruption in your plans to have a child, or they may mean that if your disease is at higher risk and you're not comfortable coming off hormonal therapy, that you actually decide not to have a child or not to have another child. And this can lead to some real grief and loss. We have had a lot of questions about, can I become pregnant? Can I stop endocrine therapy so that I can have a child? And that's really a decision between you and your medical team, because without knowing your risk of the cancer coming back if you stop endocrine therapy and your personal preferences and how you make decisions, it's not possible for us to give you the kind of advice that your medical team would be able to give you. I've covered a lot in this video. We've talked about changes to the body, emotions, different treatment implications. Most important, how breast cancer can interrupt your life trajectory, the direction your life was going. And again, these are not necessarily unique to people under 40, but they're more pronounced in people who are under 40. I hope this has been helpful. If it has, click like and subscribe. That'll help other people find this video and you to see our other content that we put out about 3 times a week. You can drop a comment or a question below.